The next thing I want to talk about is how do we know that bacteria have become resistant to some of these antibiotics, okay? We can do antibiotic susceptibility testing multiple different ways. I'm going to show you some quick and dirty ways to do it, and then I'm going to show you the ways that are probably more proper to do. So what you're going to do with susceptibility testing is you're going to clearly have to isolate the organism from the patient, and once you get it isolated, you're going to culture it, swab a plate that is coated with the isolate, and there are, from that point, numerous ways that you can test whether or not that particular strain of bacteria is resistant to certain drugs. So we're going to talk about the Kirby-Bauer test first, which deals with the antibiotics being impregnated on little filter paper discs and seeping out into the media such that if bacteria are resistant, it's going to grow right up to that paper disc, and if they're susceptible, you'll see what we call a zone of inhibition surrounding the disc. Now, it's better to do this with a figure, which I'm going to show you in a minute, but let me talk about the advantages and disadvantages. Number one, it's easy to do, it's cheap, and you can test a number of different antibiotics on one plate. The disadvantage is that it gives you a qualitative result. It's not quantitative like some of the other tests that I'm going to show you. So let's look at Kirby-Bauer. In this example, in this big blue circle, we've got the background is going to be coated with bacteria. So pretend, for our purposes, that this background that's sort of bluish is bacteria. And each one of these little cross-marked discs represent different antibiotics, as you can see in this table. Okay? So you take the isolate of bacteria from the patient, you smear it across a particular plate, and you add antibiotic discs to that plate. You let it grow overnight, you come back, and you will see zones of inhibition where the bacteria did not grow if it's susceptible to that antibiotic. So you can see in this particular example you have the largest zone of inhibition, and you're going to measure the diameter of that zone of inhibition to give you kind of an idea of susceptibility versus resistance. Here's another case where you can measure the diameter. Now, the additional discs, so you see one here, and these three over here, the organisms grew right up to the disc and were not inhibited by that disc at all. That means, in general, that they're considered resistant to that particular antibiotic. Now, what you have to be careful for is they can easily put this on the USMLE. They'll give you an example of, let's say, Pseudomonas or E. coli. You've started maybe treating a UTI with a sulfa drug. E. coli is not responding, so they're going to do a Kirby-Bauer test, for example. They will probably give you a list of a known table. So, for example, we'll say for E. coli, ampicillin, if we have a zone of 10 millimeters of inhibition, that means it's susceptible. Maybe we have a zone of 2 millimeters of inhibition, and that means it's resistant. Then you will get the information from the actual test, as is shown here, and you're going to have to refer back to the table that they give you to determine whether or not it's sensitive or resistant. Okay? Now, we have other rapid methods for detection of antimicrobial resistance. For example, we can take the isolate from the patient. We can add a chromogenic, color-changing beta-lactam, and if the organisms isolated from that patient have a beta-lactamase, it will cleave the beta-lactam and you'll get a color change. And those tests you can do in 5 to 10 minutes. So that's a relatively simple test to do. Now, the MIC is really the right way to do things because you not only get a qualitative answer, you get a quantitative. So you're actually going to get a number. And the MIC is typically the dose that you're going to use when you're prescribing medications, the minimum dose of antibiotic that you need to inhibit the growth of the bacteria. Okay? So, what is the procedure for the MIC? We're going to take an isolate from a patient, and we are going to put the same concentration of bacteria in all of these tubes. What we're going to vary is we're going to increase the concentration of antibiotics that we're using. So we're starting with none. We're adding 0.25 micrograms per mil. We're doubling it, doubling it, doubling it, doubling it. And the lowest concentration in which you see no growth at all is the MIC. So you're basically kind of eyeballing this tube and saying, you know what, there's no turbidity there. The MIC is roughly maybe around 1 microgram per mil. All right? So it gives you an idea of what the minimum concentration is needed to inhibit the growth of that bacteria. It does not indicate killing levels, and that's what I'm about to show you. The minimum bactericidal concentration is the concentration of drug needed to completely kill the bacteria. Again, you want to use the lowest concentration of drugs available to completely kill the bacteria. So you basically run a normal MIC, and instead of just eyeballing that tube, what you're going to do is you're going to plate organisms from each one of those tubes onto an agarose dish. And the lowest concentration showing absolutely no growth on subculture is your minimum bactericidal concentration. So whereas before we eyeballed in the MIC 1 microgram per mil, if we subculture it, we actually still get a few bacteria. Okay? And even if we subculture 2 micrograms per mil, we still get a few colony-forming units there. It's not until we subculture at 4 micrograms per mil that we don't see any bacterial growth at all. Now, clinically, when are you going to use the MBC? You're going to use MBC when you've got somebody that's immune compromised and can't fight for themselves, okay? So in order to treat some bacterial infections in immune compromised patients, that's when the MBC is going to be valuable. Now, the last test I want to talk to you about is the E-test. The E-test is really nice because it combines the quantitative nature of the MIC with the ease of the Kirby-Bauer test. So what we're going to do is we're going to take a plate, again, culture it with bacteria from the patient that we isolated from the patient, and we're going to put a piece of filter paper basically on that plate, impregnated with an antibiotic. The difference here is the antibiotic gets increasing in concentration as you go down this little strip. So what happens is the zone of inhibition actually correlates to a number that's on this little strip of filter paper that correlates very well with the MIC. So this gives you a really good idea of the quantitative number that you would use for the MIC. So it gives you a little bit more flexibility. Now, the last thing that you have in that chapter talks with sterilization and disinfection, and that's pretty straightforward, so we don't feel the need to cover that in the videos. So what I'm going to do then right now is conclude chapter 3.